Good morning, everyone. Thank you so much for joining our webinar with Pantai Hospital Klang. I'm Paywan, a caring pharmacist, your host for today. We have a very interesting topic to discuss. It's about cervical cancer. So, pretty ladies, if you ever experience heavy menses or bleeding after sexual intercourse, right, then this sharing is going to benefit you. Also, we will have a giveaway session later towards the end of the session. So 50 ringgit caring vouchers will be given out. All you need to do is just to answer a simple question. All right, very easy. So do remember to like Caring Facebook page and also Pantai Hospital Klang Facebook page as well, because we are going to post the winner announcement there next week. So today's session is going to be fun. Let's get started. Ladies and gentlemen, we are honored to have Dr. Mohamad Faisol, a consultant, obstetrician, and gynecologist from Pantai Hospital Klang, here to share with us what cervical cancer is. So if you have any burning question or concern regarding cervical cancer, don't be shy. Just type your question in the comment box below, the meeting chat there, all right? And then we will get Dr. Faisol to answer them all. So now, please join me in welcome Dr. Faisol.
Hi. Good morning, Paywan. Good morning, everyone. Thank you for having me today.
Welcome, Dr. Faisol. How are you?
Hi, doing good. I'm doing good this morning.
Wow, oh, I still can hear. Is that your kids?
I am my son, yeah.
Oh, okay. Thank you, yeah, for spending your lovely Saturday morning with us at home, right now?
Yes, that's correct, Paywan.
Okay, yeah, so most of us always think that cervical cancer is something regarding females' concern only, but actually it's very important for gentlemen as well, right? Like, for
Yeah,
example,
that's good.
husband or boyfriend or father. So do we have any gentleman audience here? If have, you can actually type one at the meeting chat there. Let us know. We have all the gentlemen here as well. Oh, seems like nobody is responding. All right. So I think audience here are quite excited to know more about our cervical cancer topic today. So over to you, Dr. Faisol.
Okay, thank you, Paywan. Let me share my screen.
Okay. Okay, we can see your screen now, Dr. Faisal.
Okay.
Yeah.
Hi, good morning. Assalamualaikum. Very good morning to everyone. I'm Dr. Mohamad Faisol, obstetrician and gynecologist at Pantai Hospital Klang. Thank you for joining us today. Thank you so much to Caring Pharmacy for inviting me for today's sharing regarding cervical cancer. For your information, January, 2 months ago, is a cervical cancer awareness month every year. Without further ado, I think we can continue with today's sharing. Okay, this is my outline of presentation. We will start with why women have abnormal menses, a few causes, followed by simple explanation of female reproductive system. After that, we will learn incidence of cervical cancer in Malaysia and also worldwide. I will explain to all of you what are the risk factors in cervical cancer and also why human papilloma viruses is so important in cervical cancer disease. Then, what are screening modalities available for cervical cancer, followed by HPV vaccination. Lastly, a brief explanation of disease staging in cervical cancer and also treatment modalities for cervical cancer. Okay. Do you have heavy menses or bleeding after intercourse? There are so many causes. Why does some women have this problem? It could be because of fibroid, any abnormal growth in the womb or uterus. Sometimes it caused by the endometrial hyperplasia, which is precancerous lesion for endometrial cancer. Cervical causes here, it could be a polyp, which is non-cancerous or benign, or cervical precancerous, which is precancerous condition before develop to a cancer or cancerous lesion. But rarely hormone imbalance might cause this issue. Okay, this is a brief female reproductive system, which is, I think, it is important to us to know. Of course, female have a womb or uterus, which is a pear-shaped structure situated in the middle of the pelvis with a fallopian tube at the sides, right and left, and ovaries. One set of ovaries, right and left. At the bottom, there are cervix over here, which is and also cervix and also the vagina. The top, okay, we can see from this is top right picture. This is how does a normal looking cervix looks during examination. Now we're going to for the incidence of a cervical cancer. Actually, cervical cancer is the fourth common cancer among women globally, with an estimated about 600 new cases, quite a number, every year. Actually in 2020, and it caused about 342,000 deaths in 2020. 90% of the new cases and also the death worldwide in 2020 happened in low and middle income country. In high income country, in developed countries, the programs are in place which enable girls to be vaccinated against HPV and women to get screened regularly and treated adequately if they positive for cervical cancer. Screening allow precancerous lesion to be identified at the stage when they can easily be treated. In the low and middle income countries, there is limited access to these preventive measures, and the cervical cancer is often not identified until it has further advanced and symptom develop. In addition, access to the treatment of cancerous lesion, for example, the cancer surgery, radiotherapy, chemotherapy may be limited in this country. So it results in higher rate of cervical cancer in this country. As you can see, the incidence of cervical cancer, the fourth common causes cancer in a woman worldwide. Number one is a breast cancer, it's about 24.5%, followed by colorectal or bowel cancer. Number three is lungs, 8.4%, and cervix uteri, or we call it cervical cancer, is at number 4. Let's see in Malaysia. In Malaysia, the breast cancer is the most common cancer since 2007 in Malaysia generally. I mean for female and male. According to Malaysia National Registry report in 2019, this is the latest report. Among a woman, the most common cancer is a breast cancer, followed by colorectal cancer or the bowel cancer. Third is cervical cancer from 2007 till 2016, lungs cancer, ovary, uterus or uterine cancer, and so on. Okay. However, in year 2020, about 1,740 new cases were reported or diagnosed, and in that particular year, it is actually the second most common cancer among female aged 15 to 44 years old, even though cervical cancer is a preventable disease or a cancer. So just now, it is actually the third most cancer. In 2020, the latest report showed it reduced to number 4 in Malaysia, the cervical cancer. Number 1 is still the breast, the most leading common cancer in Malaysia, followed by the colorectal or bowel, ovary, and number 4 is a cervical cancer. It's called about 6.8% of total cancer in a female. But it's second most common cancer in a reproductive age from 15 to 44 years old. The incidence of cervical cancer are around 6.5% in 100,000 population in about 10 years back, 2011. It's increased to 10.5% in 2018 over 100,000 population. And in 2022, it's reduced a bit to 10.2 per 100,000 population. There's so I mean there are reduction of new cases being diagnosed compared to 10 years back. For lifetime risk for developing cervical cancer is 10 years back, 2007 to 2011 is 1 in 116 female. In 2012 to 2016, about 1 in 144 female. So there is a reduction of the high risk or lifetime risk for developing cervical cancer. Next, when we're talking about the risk factors for cervical cancer, actually more than 95% of cervical cancer is caused by HPV infection, which human papilloma viruses. Other than that, other risk factors are multiple sexual partners, especially those having more than 3 partners, early sexual activities, means women being exposed to HPV infection at an early age. Then followed by the smoking, that we aware that cigarettes contain carcinogenic item, and also prolonged use of oral contraceptives and low sexual academic status. These are a few risk factors for developing cervical cancer. Okay, now we go to the symptoms of the cervical cancer. Majority of a woman actually doesn't have any symptom in the beginning. Okay, however, the common presenting symptoms in cervical cancer are, number 1, abnormal bleeding after menopause. I mean, women attain menopause average at the age of 52. If after 1 year they don't have any menses, then we presume they are menopause. I mean, bleeding after menopause. And number 1, it's account around 84%. Number 2 is abnormal vaginal discharge, about 72%, whether it's a clear discharge, yellowish discharge, bloodstained discharge. Then followed by bleeding after sexual intercourse, or we call it postcoital bleeding. It's account about 64%. And abdominal pain. Most of the symptoms of the cervical cancer occurs in the late stage or advanced stage of the disease. Okay, from my experience, actually, as obstetrician and gynecologist, the early symptom is sometimes women start having abnormal bleeding after intercourse. Usually, it's very minimal. Sometimes women complain of only stain of blood. Sometimes it may be associated with abnormal vaginal discharge. Once the disease becomes more advanced, they start to have abdominal pain, they have pain during a sexual intercourse, or sometimes they may have a heavy menses. Next, I think this is quite important slide, HPV and cervical cancer. Actually, HPV is a group of more than 200 related viruses, in which more than 40 type of HPV are spread through direct sexual contact. So this HPV, you know that just now I explained that it account about 90 to 95% cause of cervical cancer. It can be divided into 2 types of HPV, the low risk and also the high risk. The low risk, which means this type of HPV, it won't cause cancer, but it might cause other related diseases such as viral warts, and also a high risk HPV that can cause cancer. Okay, among these 2 types of HPV, there are 2 types of HPV that can cause genital warts, and about a dozen of HPV type can cause certain type of cancer, such as cervical cancer, anal, mouth or oral pharyngeal cancer, penile, vulvar cancer, and also a vaginal cancer. So, cervical cancer only tips of the iceberg that the HPV can cause. So, beyond that, HPV might cause other type of cancer and also precancerous lesion. So, the others cancer may not be detected until they cause health problem. Okay, in HPV type 6 and 11, it causes 90% of the genital warts in male and female actually. And HPV 16 and 18, the high risk type of HPV, it causes most of the cervical cancer, up to 70 to 80% of cervical cancer. While other type such as 31, HPV type 33, 45, 44, 54, 48, it causes an additional 10 to 20%. So most of sexually active person, they will have HPV infection at some point in their life. However, almost 90% of the population, male and female, it will clear the infection within 1 to 2 years. So remaining about another 10% that we have recurrent, chronic, prolonged HPV infection. So, although most of the HPV infection clear up, but I said just now about 90% on their own, and most precancerous lesion resolve spontaneously. So this is a risk for all women that HPV infection may become chronic and precancerous lesion progress to cervical cancer. So it takes quite some time. It takes about 15 to 20 years for cervical cancer to develop in a woman with a normal immune system. However, those with weak immune system, for example, woman is diagnosed as HIV, or those people, they on any immunosuppression drugs or medication, it takes earlier. It takes about 5 to 10 years to develop the cancer. We're talking about cervical cancer. However, there is no screening. I mentioned before, there is no screening for most cancer caused by the HPV except in cervical cancer. Actually, in Malaysia, the incidence of HPV infection among, they did a study, among the healthy women is reported to be approximately 7%. Okay, even though they have no symptom, they're healthy, they did a screen. There's a one report reported about 7%. A healthy woman in Malaysia have a HPV infection. Okay, now you're talking about talking about HPV and cervical cancer. Okay, when the body immune system cannot get rid of the HPV infection with a high-risk HPV type, the 16, 18, 31, 33, they can linger over time and turn normal cell in the cervix, on the cervix, into abnormal cell, and then later on develop cancer. About 10% of women with HPV infection on the cervix will develop long-lasting HPV infection and then put them at the risk of cervical cancer. The abnormal cell changes that we call it precancerous or CIN, or cervical intraepithelial lesion, or cervical dysplasia, as we can see on the first diagram. The top picture shows how the cell look like during the HPV infection. The CIN1, CIN2, and CIN3 is a precancerous lesion. By years, it will progress to cancer if no treatment taken. But most of the CIN1 in a young woman, they will be resolved spontaneously. What the bottom pictures show is a picture of cervix during examination. We can see the normal cervix is pinkish, round like round like structure. This is a CIN1. Most of the time, it regresses spontaneously. We can see the small lesion at the middle of the cervix here. This is a CIN2 and CIN3. The area of the lesion is much widened, and CIN3 is much worsened. Of course, at the late or at the end of the stage, the cervical cancer is developed, you can see the abnormal area might involve the half or the whole cervix. If this is for this picture, it involves the lower part of the cervix, about 1/4, half of the cervix. This is the whole cervix. This is about 50 to 60% of the cervix. Okay. Okay, cervical cancer be prevented? Of course, yes, through screening and HPV vaccination. Okay, this is a screening test for cervical cancer or precancerous lesion. We call it cervical cancer screening in Malaysia. Been advocated since 1969 through a conventional pap smear. Most of the time we know that we had a pap smear or polynuclear smear. It became a national program in 1995. The service later was expanded with the development of the national pap smear screening program in 1998 to all eligible women aged from 20 years old to 65 years old. Minister of Health recommended screening yearly for the first 2 years and 3 yearly subsequently if the results are normal. In 2014, liquid-based cytology been introduced to Malaysia to replace conventional pap smear. The main objective of the screening is for prevention and early detection of cervical cancer. However, the coverage is still low, only about 22%. But this is in 2012. The other method of screening for cervical cancer is HPV DNA test. HPV DNA testing is a test to detect high-risk HPV infection, especially the 16 and 18 that cause majority of cervical cancer. It is eligible for sexually active women from the age 30 to 49 years old. For those women 20 to 29 years old and above 50 years old, they are recommended for cervical smear, the TIM PrEP or pap smear. If, let's say, the woman tested negative for HPV infection when the 16 and 18, so they can repeat the HPV DNA test after 5 years. Let's say for pap smear, repeated after 3 years. However, in the HPV DNA test, we repeated after 5 years. Women can take their own sample, or it can be done by the healthcare provider. If, let's say, the test came back as positive for high-risk HPV, or we call it oncogenic HPV, the 16 and 18, so that particular woman need further assessment by the gynecologist. Okay. Actually, how much it costs the HPV DNA test? Actually, it is free at LPPKN. I got it few days ago from my website at LPPKN. It is free at LPPKN, or women can opt for a self-kit and perform self-collection at home. Okay, there's a few brand available. Okay. You see here at the website, we call it Dr. On-Call website. The price is 250, but after the voucher, 38 ringgit and 40 ringgit, it costs about RM 170 to 180. So the sample, you order the HPV DNA test online, they send to home, and then there's it show how to take the sample, put it inside this container, so the sample can be couriered via the CityLink, and result will be available for the woman after the 7 days specimen sent to the lab. It's quite good actually, and they will provide free doctor's consultation once the result is ready. So the other one is almost the same, but this is from we call it Evelyn Brush. Okay, almost the same method. Courier, they will courier to you and then take the sample, and once the sample sent back to the lab, and then result will available via the email. Okay. A bit of regarding HPV infection. HPV infection works extremely well. Actually, HPV vaccine has the potential to prevent more than 90% of the cancers caused by HPV. Okay, the HPV vaccine works the same way other vaccine do. It stimulates our body immune system to develop antibodies to fight against HPV. In doing so, our body can recognize an HPV and fight it before it has a chance to attack a healthy cell. As a vaccine closely mimics to HPV virus, the body can create an immune towards the actual virus. While the HPV vaccine is effective in preventing the virus from infecting the cell, actually it is not capable of treating existing HPV infection or complication caused by the HPV. Means, let's say, somebody did a HPV DNA test, it came back as positive, and then let's say you want a HPV vaccination, the HPV vaccine won't treat the current infection, but it will prevent future infection from the HPV virus. HPV vaccination for boys and girls aged 9 to 14 years old is recommended. 2 doses given with 6 months apart. Okay, if let's say the first dose given after 15 years old, 3 doses need for full protection at 0, 2 months, and 6 months. In Malaysia, actually, we have 3 types. We have 3 types of vaccine available. We have Cervical, we call bivalent. It will cover the HPV 16 and 18, the most oncogenic one. We have 𝐻PV, it's bivalent. 4-valent means it will cover 4 subtypes of HPV infection, the 16, 18, 31, and 33. And the other one is 𝐻PV 9. It will cover 9 types or 9 subtypes of HPV infection. The most oncogenic is 16, 18, 31, 33, 45, 50, and 58. And at the same time, it will cover the HPV that cause a viral warts. It's 6 and 11. So it means it can be used in a male also. Okay, to promote HPV vaccination program among Malaysians, actually government has introduced tax relief for vaccine. So HPV vaccination, one of it, up to 1,000 in, not mistaken, in 2020, year 2020. So in Malaysia, actually HPV vaccination program has started since 2010. So all 13 years old female Form 1, they will given the HPV vaccination at school. Okay, this is a bit explanation, regarding staging of cervical cancer. Cervical cancer have 4 stages. Of course, number 1 is pre-cancerous lesion, in which we call a CIN1, CIN2, CIN3. It takes years, 15 to 20 years, before it may develop cervical cancer. So once it's confirmed cervical cancer, it divided. We have 4 stages: stage 1, stage 2, stage 3, and stage 4. For stage 1, the cancer lesion or cell is confined to the cervix. Stage 2 is the cervical cell or cervical area abnormal cancer will spread beyond the cervix. In stage 3, the disease extend more than the cervix. Sometimes it's involved the vagina at the bottom or at the side. It will involve part of the muscle and also the ureter, so it will affect the kidney. And number 4, of course, is the advanced stage. It involves the bladder at the front of the cervix, at the back of the cervix. You have bowel, and it goes into distant area, for example, bones, lungs. Okay, this is a bit of treatment for cervical cancer for pre-cancerous lesion, or called CIN just now. It can be treated with removal part of the cervical tissue. Let's say someone undergoes pap smear or smear and then detected any abnormal cell, they will go for a next step. We call it colposcopy. Take a biopsy from the cervix. When it's confirmed it's precancerous CIN1 or 2, the woman will undergo conization of the cervix, the removal part of the abnormal tissues. For early cervical cancer, surgery is the main modality most of the time. If the woman is completed a family, is major surgery, removal of the womb or the uterus. And lastly, for the advanced stage, chemotherapy and radiotherapy is indicated for the cases. Okay, I think almost finished my slide. We have learned a lot of regarding the cervical cancer this morning. I think for take-home message, actually cervical cancer is a preventable and treatable disease if it detect early. With that, thank you so much. Back to you, Pewan.
Thank you so much, Dr. Faisol, for your insightful sharing. I think most of us learned a lot regarding the information of our cervical cancer, the HPV virus as well, and also how to treat it and then how to prevent it. So everyone, in the end of this session, we are going to give 5 caring cash voucher, 50 ringgit. So what is the question to win this voucher? So listen here. Cervical cancer is the number 3 most commonest cancer among Malaysian women, following breast cancer and colorectal cancer. True or false? Just answer this question and then you might stand a chance to win the 50 ringgit caring cash voucher. All right. So also like our Facebook page for our Caring Pharmacy Facebook page, and also our hospital, Pantai Hospital Klang Facebook page as well. Okay, so questions from the floor. Any question from the floor? I think Dr. Faisol is very excited to help us to answer all the questions as well. Don't be shy, you might just type your question here. So Dr. Faisol is ready to help us to answer the question. Okay, actually from me myself, right, I'm quite interested on the HPV DNA. Dr. Faisol, it's really my first time to hear about this thing. And then Dr. Faisol, just now you do mention regarding the, we can actually get it free from the LPPKN. So maybe you could explain more. It's like how we can actually apply for it or how the procedure.
I think for LPPKN, even a clinic kesihatan, I asked before, actually you can, whether you make an appointment with LPPKN with them, that's number 1, or walk into any LPPKN at LPPKN, and then you say you want to do HPV DNA test, and then they will provide you the kits. I think most of the time, I mean, the woman can do self-sampling at a room provided, or let's say they are not comfortable to do it by themselves. I mean, they can ask help provider, maybe staff nurses to help them to do it. Yeah.
Okay. And then, if let's say we are, for example, just now Dr. Du mentioned regarding we can purchase this test kit through the doctor on call, right?
Yeah.
So whenever we get the sample, we need to send back to the particular authorities, or this kind of procedure. So that kind of sampling of the sampling, right, it won't cause any like the heat during the transportation, we won't defect the sampling.
No, because it's how it's stable in a room, or it won't any heat, it won't damage the sample. So that's why they can send it to us at home. Okay. I mean, women can take sample by themselves, put in the container. There's an instruction how step by step in Malay and also English how to take the own samples, put the sample back into the container, seal it, and then they provide everything, and then give it to a CityLink counter, and then we'll email, not an email, they courier to the lab.
I see.
Yeah.
So after that, they will email us regarding the result, everything, right?
Yes, correct.
And then if let's say any further consultation needed, they will actually schedule an appointment for us.
That's correct. I mean, they will, once the result available, I mean, they will make an appointment with the doctor on-call team. They will provide consultation, free consultation with the doctors pertaining to the result.
Wow. Okay, that is actually very good service, so that we can actually reduce the risk of getting this HPV cancer as well. Because
Correct.
like what doctor mentioned just now, there is actually no symptom at all, right? Unless we come to the late stage.
Most of the precancerous lesion, they don't have the symptom. Except once they are a bit advanced age, or they already have a cervical cancer, and then they start having symptoms.
Okay. So doctor, throughout your career life, right? I think it's a bit private, this question, but I think we can actually share with our audience here. So the youngest patient that you encounter to have this HPV cancer,
Cervical cancer, I think I've seen 20 years plus, 20 years.
20
yes.
years plus.
I've seen it. That most of the time it's still in early stage.
Early stage. So how do they actually find out, or they just come for the normal checkup screening, and then you actually find out this patient is having this cervical cancer?
Usually they came with the complaint of bleeding and any abnormal bleeding. And then we took a smear, we took a sample, it came back as abnormal. Yeah,
because it's very important for us pharmacists to get to know all this also, because we are considered frontline as well. So sometimes the customers or the patient, they are shy to go to see the gynae. So mostly they'll come to us as a pharmacist first. They will complain of like non-stop bleeding, or they have bleeding 1 to 2 weeks continuously. They will actually ask for some pills to stop the bleeding. So usually for this kind of cases, right, I will just ask them to go to see a gynae. Because I say gynox is still the expertise of the doctor, so you should definitely go to see gynae, and then we need to do all the screening, so that we know what is happening to you. So I think this is the better and definitely the most option for the it's what the patient should do.
That's correct, Pawan. Actually, I listed a few causes why the woman have abnormal bleeding or irregular cycle. First, we need to make sure this is not related to cancer. That's the most important thing. So you need proper examination, screening. Then let's say the bleeding is not because of cancer, and then the woman might have a benefit from oral medication or something to stop the bleeding.
Correct. Because I think it's not very common, or we should say Malaysian women, we are quite lack of awareness to do all these screening, like 2 to 3 years once, right? Most of them, I think they don't do.
Yes, I think that's correct. But it's good now we have that HPV DNA test, which is women can do themselves, do the self testing at home, then courier to the lab. That's very good actually.
Correct. Because even me myself, is my first time to heard about HPV DNA. So I can encourage our customers or patients to purchase themselves also. Okay, doctor, you have any other like take-home message first?
Okay, I think the last take-home message, that the only thing I would say, I think most of women, especially in Malaysia, the best is you go for the screening for the HPV DNA, and then because we know that cervical cancer is one of the diseases that can be prevented or treatable at the early stage.
Yeah, we always say prevention is better than cure. So this
Yes,
is
correct.
what we can always do, right?
Yeah.
Yeah, Dr. Faisal, we have one question from our audience. So
Yeah.
this is the question. Can cancer come from a cyst?
Can cancer come from a cyst?
Yeah.
I think this is pertaining to ovarian cancer. Because in cervical cancer, because cervix, it won't develop any cyst at the cervix. For cervical, we're talking about cervical. Okay, let's see, we're talking about cervical cancer. I mean, before it develop, I mean, somebody develop cervical cancer, they will start to have a HPV infection for quite some time. And then they have this precancerous lesion, they see in 1, 2, 3. Later on, they develop a cervical cancer. When about the question whether the cyst can turn into cancer, the answer generally I would say yes, but most of the ovarian cyst, let's say ovarian cyst, it is benign. Most of the ovarian cyst is benign. But for the question, yes, it can turn into the cancer.
Yeah. Actually, I think the cyst, right, is more to ovarian cancer, like what Dr. You mentioned just now. So just now, what Doctor actually discussed more about is about the cervical. Is the cervix is different. Yeah. So we have any other question from the floor? We welcome any question. Yeah, Dr. Faisal is very excited to help us to clear our doubt as well. So no more. Okay, so just to remind all of you again, towards the end of the session, we have these giveaway vouchers, 50 ringgit carrying voucher. All you need to do is just to answer a simple question, which is, cervical cancer is the number 3 most commonest cancer among Malaysian women, following breast cancer and colorectal cancer. True or false? All right, so I think we come to the end of the session. Thank you so much. So thanks again, Dr. Faisal, for your informative sharing, and also your time to spend with all of us. Indeed, I've learned a lot today, especially regarding the HPV DNA test, and I believe all our audience here does too. So ladies, stay okay. So let's say goodbye to Dr. Faisal first. Thank you so much, Dr. Faisal.
Okay, thank you. Thank you, parent. Thank you, everyone. Bye-bye.